Can MRI and ultrasound detect seronegative RA? Have you ever wondered if imaging tests can help diagnose seronegative rheumatoid arthritis? The answer is yes. Both magnetic resonance imaging and ultrasound are effective tools for detecting this condition, even when common blood markers are absent. Seronegative rheumatoid arthritis refers to cases where the typical serological markers, like rheumatoid factor and anti-citrullonated protein antibodies, are negative. This can make diagnosis tricky, but imaging can provide valuable insights. Ultrasound, particularly high-frequency ultrasound, is quite adept at identifying important features of rheumatoid arthritis. It can reveal synovial hypertrophy, which is the thickening of the joint lining, and power Doppler signals that indicate active inflammation. Moreover, it can show bone erosions. Studies have demonstrated that ultrasound scoring of these features has high sensitivity and specificity for diagnosing seronegative rheumatoid arthritis. This means it can effectively distinguish seronegative rheumatoid arthritis from other joint diseases, such as osteoarthritis. Interestingly, the ultrasound findings in seronegative rheumatoid arthritis patients are often similar to those seen in seropositive rheumatoid arthritis patients, which underscores its diagnostic value. On the other hand, magnetic resonance imaging offers a detailed view of joint structures. It can visualize synovitis, which is inflammation of the synovial membrane, and tenosynovitis, which is inflammation of the tendon sheaths. MRI can also detect bone marrow edema, a precursor to bone erosions, and early bone erosions themselves. One of the advantages of MRI is that it can identify these changes earlier than conventional radiographs and, in some cases, even earlier than ultrasound. It provides multiplanar images that help assess both bone and soft tissue involvement without exposing patients to radiation. In clinical practice, when blood tests are negative but there is still a strong suspicion of rheumatoid arthritis, both MRI and high-frequency ultrasound are recommended. These imaging modalities can detect early inflammatory and structural changes that are crucial for timely diagnosis. Early detection is vital, as it allows for prompt treatment, which can help prevent joint damage and disability. In summary, ultrasound is excellent at detecting synovial inflammation, blood flow related to active inflammation, and bone erosions with high sensitivity and specificity in seronegative rheumatoid arthritis. MRI is effective in identifying early inflammatory changes, including synovitis and bone marrow edema, providing a comprehensive assessment of the joints. Both imaging methods complement clinical evaluations and serology, enhancing the early diagnosis of seronegative rheumatoid arthritis. The imaging findings in seronegative rheumatoid arthritis are similar to those in seropositive rheumatoid arthritis, reinforcing their utility even when blood tests are inconclusive. If you suspect you may have seronegative rheumatoid arthritis, it is important to undergo a thorough clinical evaluation combined with imaging studies like MRI or ultrasound. These tools are invaluable in confirming the diagnosis and guiding management, but always remember to seek professional medical advice for personalized care.